Hey everyone, we're here with our Revive total body transformation patient, Lori. Lori comes to us, is it Kentucky? Is that it?
Kentucky.
Yeah,
Yes.
that's right. So, Lori, why don't you tell us about your experience with our program and how it's helped you?
Okay. So, February 17th is actually when I started the program. I talked to you maybe a few days before that, before I got the package in the mail.
And you were a little skeptical at first. I
I
remember.
was.
Yeah, you're like, I don't know. Is this guy?
Yeah,
I don't know about these TikTok people. It's one of those dudes.
that's exactly right. Because I told my sister, I said, well, I found him on TikTok. And
Yeah,
so,
exactly.
um, but our initial phone call, you had told me, first you have to be, committed to the program.
Yeah,
One, and um, one of my big problems was not drinking Diet Dr. Peppers.
oh yeah, yeah. I get a lot of people that diet soda, man. They live on it.
Yes,
And you were living on
yes.
it. You even admitted it.
That's all I drank. At least a 2 liter or more a day.
Wow.
No water,
Yeah,
nothing else.
yeah,
So before I even started the program, I think when I talked to you about that, maybe it was February 10th.
yeah,
And I decided that day that was the last day that I was going to have Diet Dr. Pepper, and it has been.
yeah.
It's always been
I
a
can
struggle.
identify you because I was that way with Coca-Cola. I mean, there
Yeah,
was a point in my life where from the time I woke up in the morning till the time I went to bed, that's all I drank.
that's all I drank. Yes, and I mean, I would have it beside me while I slept,
Oh yeah,
and that's what I drank.
yeah,
But I decided that day, something's got to change.
yeah,
And so I decided, I'm not going to drink anymore. We'll start there because, I wasn't getting the drops
right.
till, I think it was a week later when I got the
Yeah,
drops. And I decided that day that I wasn't going to drink the Diet Dr. Peppers anymore, and go straight to water. Now, to be honest, that week I struggled,
yeah,
not having that.
right.
Um, since I've started the drops,
Yeah,
I don't know. I don't know if the drops has anything to do with it,
right.
or if it's just that I'm so motivated. I don't know, but I have absolutely not craved a Diet Dr. Pepper since I've started the drops
Yeah.
at all.
Well,
And
let
found,
yeah, go
go
ahead.
ahead.
Well, let's tell everybody what the drops are because you mentioned it. So they're amino acid drops. They're sublingual. You put them under your tongue, and it helps transition your body into fat burning. And the other one's an appetite suppressant. So it's that appetite suppressant that fools your brain into saying, "Yeah, you don't need Diet Dr. Pepper."
Yeah,
That's what prevents the craving. So you are correct
yeah,
about it. Yep.
yeah.
So go ahead.
Um, and so, and I have found that since I've started drinking water,
Yep.
crave more water, which I've never done in my life.
Yeah.
So, um, that's been a huge plus for me.
Yeah.
And, I was really worried about the diet
Yeah.
that I was going to have to do because I'm not a huge veggie eater. And
You
so,
were the first patient that told me I hate vegetables. You just came out and said, I don't eat vegetables. And then I said, you and I have to talk. We got to
yeah,
have a conversation. Yeah. You're the only person I know in the world who hates every single vegetable. But tell
now
everybody what you're doing.
I do eat some, but not like what most people would eat
Right.
because grosses me out. But did you say tell people what I'm doing?
Yeah. Yeah.
It's
So how did you overcome because I'm sure there are other people out there who don't like vegetables. What
right.
do you do? So we're on this call to help other people. So yeah, just give them some insight.
So so what I do, as far as what the Revive booklet said, there were certain fruits that you could have,
Yeah.
berries in particular.
Yeah.
thing I think that was low glycemic.
Yeah, berries and stone fruits. Yep, exactly.
Yes. And so I do like blueberries and I do like strawberries
Good.
a lot. And so what I do with my lunch is I will do 4 ounces of strawberries and 4 ounces of blueberries
Yep.
with my I do like baby carrots, and so that's usually what I have with supper. And occasionally I do broccoli.
Right.
And green beans. I do like green beans. So I will do those every once in a while.
I told my friend, Dr. Brad Morris, I said, I have a patient, she doesn't like vegetables. He goes, tell her to eat green beans. Everybody loves green beans. And so,
I do
I'm
like
glad.
green. And so when I fix that for my family, I do eat that.
Good.
But I tend to like things that are crunchy.
Right.
And I don't cook the baby carrots. And so usually I just eat those because they're crunchy and I like crunchy. So I'm kind of picky with my diet. But you know, if you choose the things that are in the booklet that you do like,
Yeah, that's the
worth
key. Yeah. Yeah. So, and so let's get into this now. How much weight have you lost? How do you feel after losing the weight? So let's talk about that for a little bit.
Okay. So on this program, I've actually lost, as of this morning, 21 pounds.
Yeah.
I feel so much better already with just losing that much.
Yeah.
And I've shared with you before that the reason that I was searching
Yeah.
for something different was because everybody's on this semaglutide
Yeah.
or whatever that is.
Yeah.
Which I was skeptical of that to start with. One, because I mean, they tell you up front, you know, if you have a history of this kind of cancer
Yeah.
and this cancer, then we don't need to do this. Well, to me, that is scary just because, I mean, I don't know how much research has been done on it, but,
Right. No.
you know, there's not been a history of leukemia in my family either, but my sister was diagnosed with leukemia last year. And so after I did go ahead and start it,
Yeah.
and I did a little bit of weight the first few weeks that I was on that, and that just kind of stopped.
Yeah.
My sister, who has cancer, you know, she just kept telling me, you know, I'm just really scared for you to do this. And so it just kind of got me thinking, you know what? There's got to be another way that I can do this. And so I still had probably half a month of that and just stopped taking it because I was so scared.
Yeah.
And of course, any weight loss, the food cravings, everything just came back full force. I mean, it was terrible.
Every patient that has been on it has told me that. Every
Yes.
single one. Plus, many of the patients that come to me have had the severe side effects: liver failure, kidney failure, and pancreatitis. Tons of people with pancreatitis. It's a drug. There are
Yeah.
side effects to all drugs, and what we're doing is non-drug and natural, even if you used our peptide stack. And so,
Yes.
yeah.
So I stopped and of course didn't lose any more weight. And
Right.
then I had already seen some of your videos and saved you so that I could keep watching. And, you know, I was like, I don't know, you know, because you were in Wisconsin, I'm in Kentucky.
Right. How's this
You know,
gonna work? Yeah, I remember that. Yeah, that's what you asked me.
go to your office and see you. So I'm like,
Yeah.
I don't know about it. And so I probably watched you for a month
Yeah.
or so before you know, talking to my husband about it. And the cost, of course,
Yeah.
for a lot of people is going to be an issue.
Yep.
But I talked to my husband about it and I said, do you think that it's too much? And he said, if it works, it's not too much.
Yeah.
And thank the Lord, it has worked.
Yeah.
And still going.
Yeah.
My my mom keeps asking me, so when are you going to start adding things back? I said, I don't know. I'm not done losing weight yet.
Right. And that's a beautiful intro into my next topic, which is you will add things back, but not like you were before. I mean, you'll have a diet Dr. Pepper down the road, but not
Yeah.
every day, maybe once or twice a month. I mean, I still have a Coke now and then, maybe once a month, but I'm not doing it daily, and that's all I drink. So yeah, you will add things back, but you got to get the weight off first. So you are literally changing your lifestyle. So let's talk about this because I'm going to tell everybody I'm really proud of you because you came to me and you said, "Hey, Dr. J, this is a bunch of crap." You didn't say those words, but I could tell.
Right.
I'm not losing a pound, buddy. I need to lose some weight. What's going on here? And I said, listen, it's not just the drops, it's just not the peptides. You got to
Right.
follow the plan. I said, you text me or email me everything you eat. And you're like, I'm in. And you have. When I tell that to other people, Lori, I don't hear from them again because I'm holding them accountable just like I did with you. And you had enough commitment to say, all right, let's go. And that's what's made all the difference here. So some people need that.
To anybody out there, you have absolutely been wonderful as far as encouraging me, responding to me.
Yeah.
When I text you, and you respond, it's so encouraging because I told my husband, I said, my doctor said, this. He said, I'm sure it's not him. It's probably somebody in his office. I said, no, it's him.
Yeah.
I said, it's his cell phone number. We talk and we've talked on this phone, before. So I know that him. You have just been so encouraging. And I think that's what I've needed. It's somebody.
What I need. Look,
Yeah.
I'm going to see a trainer today at 120. So I lost 80 pounds. So I know what you're going through. And I had a friend of mine, Dr. Brad Morris, hold me accountable because when I would get weak, I'd be like, man, I'm ready to go have a pizza. He goes, no, back it up. So I needed just what you're saying. And some people do. But when you start holding them accountable, not everybody steps up and says, okay, let's go like you did. They'll come back and they'll ghost me. So I lost 80 pounds doing exactly what you're doing. I mean, if you go to pubmed.gov, there's countless studies showing how if you eat less food, you're going to live longer and you're going to be healthier. And if you eat the right foods, you're going to have more energy. You did text me, and at one point you said, here's my wins. It's just not the weight loss, that you had more energy, right?
Yes. And so non-scale victories is what I call them.
Yeah. Good. I'm going to steal that. I'm going to steal that phrase, non-scale victories.
Yes. It has just not feeling like I have to take a nap every single day. And I will say that has just changed since starting this program. Because when I was on that semaglutide, felt like I needed to take a nap every single day.
Right.
Just exhausted all the time. Yeah. I no longer nap. I do nap Sundays after church, but everybody
you're not napping, you're meditating after going to church. You're meditating on God's word. You need to change your perspective of that. See, that's
true. That's true. Yeah. But any other day, I just no longer nap. I don't feel like I need it. I have a grandbaby. She's 6 months old. I'll play with her. And I think that's really what motivated me. I didn't want to just feel so lethargic and tired all the time where I couldn't get in the floor. I can get in the floor and play with her now, where just a few months ago.
Yeah, that's life-changing.
It was on the couch.
Is it your first grandchild?
It is.
Oh, that's wonderful. See, our grandchild she's 3, and she did not like Grandpa for the first 3 years. So now she's coming around to Grandpa. Yeah. So Grandpa still hasn't held her yet, but that will come. So that's wonderful. And so you're able to have a life, change your lifestyle, so you're spending more time with your family, especially your grandchild.
Yes.
Wonderful. Yeah.
Other non-scale victories, the Capri jeans that I wore last summer are too big.
Nice.
bought my very first belt in years, and I wear that belt with those jeans that are too big.
Yeah.
But yeah, my biggest one I think is just the energy, just having more energy. And again, I don't know if that's probably a combination of it all. You know, the foods that I'm eating,
Yeah.
the drops that I'm taking, the weight that I've lost, just
Yeah.
everything.
Everything.
And again, that's another motivator for me to keep going, because I still have lots more to lose.
Yeah, no, and you will. Like I said, I lost 80 pounds. I went from size 40 jeans down to size 36. And once I got to 36, I threw away, or I didn't throw them away, I donated them,
Mhm.
my size 40. And I'm like, I'm never going back to them, ever. And
Yeah.
I won't, because just like you said, just making it through the day and feeling lethargic most of the day, it's not a fun way to live. It just,
Right.
it's,
It it wasn't.
no. So, anything else in closing? I really appreciate you being on this call, number one. And number two, I'm really proud of you, how
Thank
you've
you.
taken the weight off and you continue to. I mean, yeah, we're just starting this, but I wanted to get you on. And if you remember, and I asked this with everybody, I say, will you help me help others? Because people will see this. Maybe they won't even join our program. Maybe they'll just change their lifestyle and
Right.
lose the weight. I mean, I had an 83-year-old. She came to me and she goes, you know what? I just can't afford to do this right now. I'm on a fixed income. I'm on Medicare. I'm just surviving. What do you recommend? I said, stop eating carbs. Stop eating carbs today. Go keto. She did. She lost 100 pounds. Now, it was
Wow.
over the course of a year. And most 83-year-olds, as you know, Lori, they're not changing their lifestyle. They're not changing anything. It's like, I've
Right.
always eaten this way. I'm not changing. So, I mean, great for her. And now she's become a patient. Things have worked out. And she's continuing to lose weight, because when she first came to me, she said she needed to lose 200 pounds. Well, she's down 100. Now we're going to help her get rid of the next 100. So now she's become a patient with Revive. So, you just got to meet people where they're at and help them where they're at. And I always tell doctors, because I consult with doctors, I'm like, think about the patient, focus on the patient, serve the patient, and everything's going to come your way. You want to have a successful practice, put the patient first.
And that's exactly what you did when I texted you. And I've just got to be honest. I've got nothing to lose.
Yeah.
I've got to be honest with him about this vegetable issue that I'm having.
Yeah.
I tried first week and I just honestly didn't know if I was going to be able to complete the program because of the vegetables. And I thought,
Yes.
you have to be honest with him and
Yeah.
see if there's another way to do this. And you told me, focus, increase your protein, do the fruits like you were wanting
Yeah.
to do. And it's worked for
Yeah.
me. And I've stuck to the low glycemic. I had high cholesterol.
Right.
I wasn't diabetic, but the numbers were getting up there. So pre-diabetic.
This is a great segue. Let's talk about your blood work, not to get into too much of it because there's HIPAA regulations, but you had some issues in your blood work, and that needed to be addressed for you to lose the weight and keep it off. Yes, that is a vital role in what we're doing compared to anybody else out there.
Yes.
There were big issues. Yes.
And I don't know what all that looks like now, but I can only imagine that that both of those things that I was most concerned about. I know you had other things that you were concerned about. I was concerned about my cholesterol and my glucose levels. I can only imagine that they're better, but
well, and normally, and this may be a question in people's minds who are listening, we do retest you, but let's get you down 40 pounds and see where things are at 40 pounds.
Yes.
I mean, that's the key. And as you know, I didn't load you up with supplements. I mean, a lot of these diet plans, they just overwhelm people with supplements. It's like they're taking hundreds of pills. And I'm like, no, I wouldn't want to do that. Why would I have you do that? It's insane.
Right.
So, yeah, looking at the blood work, looking at hormones. I mean, we just did a hormone panel on my wife, and she'll let me talk about this. She has lower estrogen. Well, she's 64. The key to that is not giving her an estrogen replacement or a bioidentical. The key to that is looking back at her blood work and finding out why she has the estrogen. Now, we did it kind of backwards. We did the hormones first, and now we're doing the blood work. But there's a reason she has low estrogen. There's a reason you have high cholesterol. Most people have high cholesterol because their ferritin is high, and yours was. And that causes low magnesium, and that causes an enzyme, HMG coenzyme A, in your liver to jack up your cholesterol. So that's what was happening to you. So I know it will be down when we rerun the blood work with you. And
which I'm excited.
yeah, and you should be. And just so everybody knows, and you too, we're not going to run the whole complete panel again. We don't need to.
Right.
We don't need all that. What's normal is normal, but we want to look at those abnormals, and we need to look at those to make sure we're headed on the right track. And we are. I mean, I can just tell right now. So
Yeah.
great. Anything else before we wrap it up? I mean, thank you for thinking about the metabolic side. I just start talking. It's like when I'm on TikTok, I just start rambling. And my wife always says, try not to talk over people. And before we got on this call, I told Lori, I'm probably going to talk over you a bunch, but I said, just roll with it a little bit. And you've been great.
I do that too. It's
Yeah,
okay.
well, yeah. So listen, thank you so much. I really appreciate you being on. This is going to help a lot of people.
Yeah.
Even those who don't sign up for the Revive program. Just so it helps other people is what it's all about. We'll put it up on TikTok.
Something that I want anybody just to take away from this, if you're considering doing this, but need someone to hold your hand like I did.
Yeah.
Dr. Johnson will do that for you. He's done it for me. And
you're easy. I don't have to put in all caps, stop eating pizza or stop eating cheeseburgers like I've had to do with some other people. I've never done that with you, ever.
No.
That's been great. I mean, you're following it to the letter. But I'll get some of these, I'm like, hey, that's not on the menu. You got to not eat that. And they're like, okay. Those things. So,
but
good.
I just want to let everybody know that it's been a great experience for me.
Cool. Well, thank you, Lord. I appreciate it. And we'll end it right there.